Hello, everyone. So we are going to be talking about inflammation today. We have a special guest, Dr. John Dempster, who's the naturopathic doctor as well as a functional medicine doctor from Canada. Dr. Dempster focuses on chronic ailments as well as inflammatory related conditions. So that's why we thought, inflammation is such an important topic. We want to bring it to you. Welcome, Dr. John.
Nice to be here.
Thank you. So let's just talk about what exactly is inflammation.
Well, inflammation is a natural process. It's something that keeps us alive, and it's something that our bodies require to actually thrive throughout the day. But inflammation gets a negative connotation because we often think of inflammation as being bad. Now, there is definitely an aspect to inflammation that is not good, and it's something that we're seeing a lot in the research right now. It's the term of chronic inflammation or systemic inflammation. And when we have these areas of inflammation that are not in control anymore, then that can actually be a massive problem and precipitate a lot of chronic illness and aggravate a lot of underlying conditions. So there's a big difference between regular inflammation, which our bodies require, and then something called chronic inflammation, which is often associated with a lot of the autoimmune problems, a lot of chronic degenerative conditions, and so forth. So we're seeing a lot of this in the clinical literature right now. And the good news is there's a lot that we can do naturally that is very targeted and very effective in many situations.
So what are the symptoms? So let's say someone walks into your clinic, and what kind of symptoms do they have to know that they have inflammation or chronic inflammation? I take it back.
It can manifest in many ways. If somebody has a chronic skin condition, such as psoriasis or eczema, that's inflammation. Even acne is a degree of inflammation. If somebody has chronic joint pain, that's inflammation. If somebody has colitis or Crohn's disease, that's a severe inflammatory bowel disease. So inflammation can attack different organs and different systems, and it really depends on our genetic predispositions. It depends on our environmental factors, depends on a lot of our environmental and social factors as well. So a lot of these things are to be considered.
So inflammation is such a broad term. It's not just only focused on the gut or any particular organ for that matter. It could be anything. It's manifesting, like you said, on the skin, on the joints, on a lot of different things, right?
It can manifest in our brain. And we're seeing degrees of different types of anxieties and depressions and other types of mental illness that's connected to inflammatory situations. Now, you mentioned the gut. The gut is a big area to discuss because the gut is the gateway for inflammation, and it can actually lead to a lot of the issues that might be involving your skin or your joints or other organs in your body. The gut is the gateway to your bloodstream, and oftentimes that's where, as functional practitioners, we begin our investigation. This is where we begin a lot of our discussion with our patients, is talking about, okay, how are the foods that we're eating impacting our body? And it starts by what it does with your gut. There's many ways to decipher what types of foods are impacting us. That's why, if any of your listeners have worked with a functional doctor, they'll notice that there's different types of tests that are being run that are a little bit different than your traditional workup that can give us some deeper insights into some of the cause and the root triggers of inflammatory pathways. But it goes far beyond food, but food is definitely a very important spot to begin.
So you mentioned about the test, and as functional medicine doctors, there's a lot of analysis, right? There's a whole process of analysis of testing. So let's talk about different type of tests that you would do versus a conventional medicine doctor.
Well, we build on what a conventional doc will do, and we often work very much in a team environment. And so one of the things I really like to emphasize is that we're in this wonderful realm of healthcare right now where we're really starting to see this integration, and that's really why it's so important to work as a team, not as an us versus them. And so what we'll do a little bit differently to adjunct what our patients are currently getting is we'll be starting to spend time on, as I mentioned, testing for foods and understanding how foods are impacting our patients. We'll start to measure a little bit more of what's going on in the gut microbiome, and that's a collective of all the different microorganisms that can lie in there, such as yeast, bacteria, parasites, etc. And we're going to be spending some time really focusing on nutrients and understanding, okay, do we have the right amount of nutrients in our body? Oftentimes, there's many deficiencies going on with multiple nutrients in our patients that just haven't been addressed, and these can have multiple roles in our body that have direct implications on how we manage inflammation. We'll also spend time investigating certain toxins if it's necessary. If somebody has a history of being exposed to, different types of toxins like heavy metals, for example, or other toxins that are environmentally based, we can actually start to deduce if that's a massive area of concern that we need to address. So there's lots of conversations that we have. And when we actually do an initial assessment with the patient, we spend an hour to an hour and a half with them. And prior to that meeting, we actually have them fill out a very detailed questionnaire. And that questionnaire can take about an hour to an hour and a half to fill out. So you can imagine the depth of questions that we're asking even before we meet our patients, so that we can start to hone in on areas that might be the root cause of the inflammatory pathways.
So it's literally being a detective, right? I mean, 1 hour the client is spending, and then after that, 1.5 hour you're spending. So 2.5 hours, you're going to figure out everything that's going in the client, from a history of anything issues, from mental issues or digestive issues or what have you.
We get to know our clients very well, and we really try to do that. We want to make sure that we're really understanding all the nuances that are specific to each person, and that's where functional medicine is very powerful. It's a very patient-centered type of healthcare, and we're not just treating a label. If somebody has, for example, osteoarthritis, we're not just rolling out a typical protocol. We're treating that person who has osteoarthritis, so there's a difference there.
So can you talk about a couple of tests that you would recommend, like a GI map or a Dutch test? Or, I mean, what are the different tests, and what is the, why do we do these tests?
We have right now, I think we have over 100 different tests that we draw upon. We certainly don't have a rollout protocol, and this is very important to understand. I'll make recommendation of some important ones to consider, but it's always determined by the relationship between the practitioner and the patient. So if we are starting to talk about how somebody is responding to foods, we're going to be looking at different antibody tests. And there's a number of companies that do a good job at this. But I would generally be looking at an antibody test that looks at a full gamut of antibodies, things that are looking at IgG, IgM, IgA, and sometimes even IgE antibodies, which are a little bit more on the allergy side. But that's a full gamut and a full comprehensive panel when it comes to understanding how our body responds to food from an immune perspective. From a microbiome perspective, I really like the GI map. You mentioned that. That's a great test. We use that. We have others that we use as well. But that is a very powerful tool that starts to give us some insights to a lot of areas in our gut, not just the microbes themselves, but also different types of inflammatory markers pertinent to the gut, different types of digestion markers, different types of enzyme markers. All sorts of powerful data can come from this, and it's a great test to look at as well.
Okay, so now we've got the testing, we've got the questionnaire, the client questionnaire, your questionnaire, the testing. Now comes the actual treatment, right? The naturopathic treatment. So maybe you can share, I don't know if you can share a small case study, but what are the recommendations that you will give to the client?
Well, just so I'm clear, those aren't the only tests that we run. Those are two of many, and many of our patients get more than that. We're often doing a full assessment on their major organs, such as their liver, their kidneys, their thyroid, a lot of other key inflammatory markers that are in their blood that we can measure as well. We often discuss something called SIBO, which stands for small intestinal bacterial overgrowth. And then we are looking at nutrient panels too. And as I mentioned, we're looking at a nutrient panel that can measure up to 33 different nutrient markers in the body. And it's very different when you run a traditional blood test versus what's called an intracellular blood test. You're going to get a much more in-depth read when it comes to a longer term of nutrient exposure. And so a traditional blood test will give us a very short window, whereas an intracellular T lymphocyte analysis will actually give us about anywhere between 3 to 6 months of information. So you can see that becomes more powerful when we're trying to remove the things that can sway our levels to go up and down in a day or two. And so that's, we don't have, again, a one-size-fits-all protocol or package of tests. We hand-pick these to each patient. Now, to your question, what do we do? Well, what we do is really determined by what we find. And if we find somebody has yeast overgrowth or has a parasite or two, and I've seen people with multiple parasites, all sorts of yeast overgrowth, and all sorts of bacterial imbalances all in one test. So it really depends on what we're finding, but we're going to be doing some work to manage that microbiome. Does this individual have leaky gut or intestinal permeability? There's ways that we can start to get markers that would give us some insights on that. That needs to be healed and sealed. And this is why a big focus of our clinic is working on that gut first. This is why I put together a protocol called the HEAL protocol. This is in our program that we call the Healthy Gut Institute.
Mm-hmm.
And this really helps our patients get the foundation of getting things moving in the right direction.
Mm-hmm.
And so we do want to make sure we're paying attention to certain foods. Yes, there'll be massive, what we call macro foods that we're going to remove that are very prone to triggering inflammation. These are things like artificial sweeteners, sugar, different types of pasteurized dairies, different types of grains, and so forth. Those are the common denominators, but you name the food, we've probably seen somebody have a reaction to it, whether it's on the healthy list or not.
Yeah.
And we just need to make sure that that person's immune system is treating it not as an enemy and mounting an inflammatory response. Because this is the thing, back to our initial conversation about what is inflammation.
Mm-hmm.
If we have short bursts of inflammation, that's fine.
Mm-hmm.
But if we're in a chronic state of inflammation, how can we heal?
Yeah.
How can we actually truly start to improve? And if we're feeding our body foods that are chronically triggering an immune response that is secreting a number of different types of inflammatory molecules, such as cytokines and leukotrienes and so forth, how are we going to be able to heal our body if we have chronic skin issues, or if we have depression, or if we have joint pain or gut issues, when all we're trying to do is just fend off that food when it comes into our body?
Yeah.
So that's why we do really emphasize about getting down to the baseline and the root of the issues and working our way from there. We're not a palliative or a suppressive approach. We're a root cause approach. And sometimes it's important to do both, right? If somebody's in crisis and they're in chronic pain and they can't function, they may need painkillers to help them get through the day, but the painkillers aren't going to heal them. And so we need to sometimes make sure that we're bringing in the other approach alongside that typical approach.
So your approach is diet, supplements. I'm trying to understand what is the magic remedy here. What is the magic pill? Obviously it's not like I'm taking a pill here, but the magic pill will be the ingredients of food, supplements. What else? Like exercise?
Yeah, I think the whole point is that there is no magic pill. There is a solution for each person, and that's going to be a combination of dietary strategies. It's going to be a combination of different types of supplements to treat what is out of balance. In our clinic specifically, we also will do different types of intravenous infusions or different types of vitamin infusions or injections that can help augment very deep deficiencies, and that can build those up a lot quicker. And of course, there are lifestyle strategies. If somebody is not doing the amount of exercise that's required to keep inflammatory markers at bay, then we need to address that, right? There's no magic pill that will replace exercise out there. We have to always get those cornerstones in place. If somebody's not sleeping, we have to help them get into some sleep. That's how we repair. That's how we manage inflammation. That's how we detoxify. If we are stressed out and we're in a job that's driving us absolutely crazy, or we're in a relationship, or whatever that might be, everyone has different stressors in their life. These are things that we have to take stock of, because no matter how many vitamins, no matter how many diets we go on, those big things are still there. That's like trying to treat somebody who has a thumbtack in their foot and just say, hey, just keep taking aspirin. The pain will go away. We got to take the thumbtack out of their foot so that they can actually heal.
No, I think that makes sense. I think I should do a consultation with you. I'm serious. I'm having little inflammation myself on my eyes. No, seriously, no jokes. I have been. So anything else that you would like to add? What people should do if they have a chronic inflammation. I mean, that's what we are talking about. They should seek out a functional medicine doctor such as yourself, or?
Well, I think it's a great adjunct to your current care program. And this is something, again, I'm very optimistic in where we are at with healthcare right now, because we're in this really interesting time where science and technology is rising really quickly, and I love that. But also the science and technology that's showing the power of natural healing finally. And, in the past it might have been eschewed and pushed off to the side, but we're seeing that this is real medicine here, and working alongside of pharmacology and surgery and so forth, that can give the best impact to somebody. And so we need to really start to embrace the integration that's out there right now. So having a functional medicine doctor on your team is, in my opinion, very essential. But that doesn't replace anybody else on your team. So this is where I think it's time that we all come together to benefit the patient.
Yeah, I think, no, I agree with you. I mean, functional medicine, the term didn't even, I mean, a lot of people didn't even know 5 years back, right? And now functional medicine has become like the, universal type of healthcare, right? And especially in North America, people are understanding more and more about functional medicine. So, so how do we, like, let's say if I want to do a consultation with you, how do I find you?
Well, first of all, I mean, we're happy to have you.
Okay, thank you.
We'll help you any way we can. But yes, you can find us online at thedempsterclinic.com. And you'll see there's lots of resources on there. Please take advantage of those. We have all sorts of free guides and free video series. And then, of course, we have other programs on there as well. But a lot of our patients come from around the world. And during this time with COVID, it's been very interesting. But we are more than welcome to help anybody dealing with chronic inflammatory situations.
Okay, well, thank you so much, Dr. Dempster, for being with us and educating all of us on inflammation and what to do if you have chronic inflammation. So chronic inflammation is what you need to understand versus a simple one-off inflammation. And functional medicine is really the root cause medicine. And that's what we are trying to advocate here every single day about functional medicine, natural medicine, holistic medicine, whatever the word is, it's all coming together, talking about the same thing of getting down to the root cause. With that, I'd like to wrap up this session. Anything else you'd like to add before we wrap up?
No, I think this is great. One thing I love to emphasize is, a lot of times when we listen to these sessions, there's lots of great information, and it can be very overwhelming to people who are listening. And I say, look, don't worry about feeling overwhelmed. Worry about just doing one thing different. And as long as you don't need to be perfect at everything, as long as you're making progress, you're going to make some headway. And so sometimes I really like to emphasize that it's not about being a perfectionist and doing everything at once. It's about just doing something better than you did the day before. And then you're going to start to get some compounding effects from that, and you're going to continue to get better and better results going forward.
Yeah, and what I love about it is there's not just one magic pill. Like all of us, I mean, at least most of us have grown up with, okay, take a pill and you're going to be fine next day. This is more like a long-term, relationship with your mind and body to live a healthier life, like long-term, right? This is not just one pill and then you have side effects or whatever happens.
That's right. Yeah, much as like we take our car in to get tune-ups. And I say this sadly, most of us spend more time on our car than we do on ourselves. So, we need to pay attention to when the check engine light comes on. If you have signs of inflammation, that's a sign of some massive imbalances that have been happening, not just last week, but very likely for a long time. So these are the types of things that let's start to pay attention and so that get the best quality of life that we can. Yes. Let's start to do those tune-ups when we can and when they're needed. And that way we can stay ahead of a lot of things.
Absolutely. Well, tune up your body. Like, guys, tune up your body. Pay attention to your body. Listen to your body. That's what we are saying. And use functional medicine and natural medicine to help you. Thank you so much, Dr. John, for being with us. Amazing. It was just a pleasure to have you.
Thank you, Amanda. Have a great day.